of the side effects of this pandemic is a sharp drop in life-saving organ transplants. Transplant centers across the country have massively scaled back as hospitals shift priorities to be able to handle COVID-19 cases. Living donor surgeries have largely shut down, and deceased donor transplants are happening only when the case is urgent. Sadly, that means many organs are not going to good use. And as Allison Vuchnich explains, those on the waiting list keep waiting.
This is the only way we get to see each other.
At a distance, John Dennis waves to the love of his life.
It's okay, don't cry. I miss you very much.
Penny is living with dementia. Her long-term care home has residents sick with COVID-19. It's just too risky to visit for both of them. John has idiopathic pulmonary fibrosis and needs a double lung transplant. COVID-19 can be a killer, especially for someone with lung disease.
To COVID-19 get the hell out of the way. To my family. I want my family to know I'm not giving up the fight.
And John's the right guy for a fight.
I don't know if they can see that on the camera.
An avid adventurer, he even competed in an around-the-world sailing race. He's now in the fight of his life.
I need it. Oh, I need it. Yeah.
If all goes well, John would travel from Halifax to the Toronto General Hospital for transplant. This is the largest transplant program in the country and one of the top in the world. This is a center of innovation and life-changing surgeries. With the COVID-19 wave coming, on March 13th, the hospital announced it had to scale back transplants. Heart, liver, kidney, pancreas, and lung delayed unless a patient is rapidly deteriorating.
When we do a transplant, we put patients on anti-rejection pills, and that means really knocking down their immune system. And we're very worried if we do that to patients, and then if they get COVID, they'll end up with very, very severe manifestations of COVID.
That also means COVID-19 patients and transplant patients could end up in the same ICU, both needing ventilators. Spreading the virus is a concern.
COVID seems to also infect the liver and the kidney and the heart, so we're very concerned about that.
In early March, Jim Mann finally got the call that he's officially on the transplant list. Soon after that, another call about the delays. Jim needs a double lung transplant for severe emphysema.
The COVID-19 is what scares me more than the surgery. They've told me if I got that, then my chances of survival are very, very minute.
You feel really let down, and it kind of breaks your heart because we had that hope. And then it's kind of like, oh, it's on pause and nobody knows how long this is going to go on for.
So for Jim, outgoing, fun-loving, and always willing to help a friend, is inside protecting himself while he waits.
Every time the phone rings still, even though we know it's closed, I still have a little bit of hope that that's what it is.
And it's not just in Toronto. Transplants are on hold or reduced at centers across the country, leading doctors who refer patients to worry.
This does have a huge impact on my patients, but all transplant patients in general across Canada. There's multiple effects. So there's patients right now who are very unwell and getting sicker quickly.
Another devastating consequence is that with programs across the country scaled back, so too is the procurement of donor organs.
So essentially those organs are not used, they're lost to the system, which is really another tragedy due to COVID. So it's very heartbreaking, actually.
Hundreds of Canadians die every year waiting for a transplant, and now COVID-19 is making that even tougher.
The number of patients on the wait list is growing, and that will create a backlog.
During the last month, Toronto General has performed more than 15 urgent transplants with safety precautions in place and testing all donor organs for COVID-19. All the precautions and gained knowledge is leading to renewed hope. Dr. Humar says he's actively working on how to increase the number of transplants performed and is optimistic that can start soon. Until then, Jim and John are staying safe and hopeful.
I know there's a fix down the road. It just, hopefully it comes before I can't go on anymore like this.
I know it's getting worse. I just hope I can make it to Toronto. That's all I ask. Give me a chance.